I'm Dr. Cecil Bennett. I'm a family physician in Atlanta, Georgia. The name of this talk is Take Your Medicine and Like It. You know, there's those of us from the Caribbean, whenever we got in trouble as children and we were gonna get a spanking, our parents would always say to us, you're gonna take your medicine and you're gonna like it. Well, that was a bad thing. This video is gonna be about the good things of why we should take our medications as prescribed. Taking medications as prescribed is very important for effectively managing chronic health issues like hypertension, diabetes, and high cholesterol. Medication compliance prevents complications, improves overall well-being. Failure to take medications as prescribed is a serious concern that can lead to worsening illness, hospitalizations, and even death. What are the benefits of taking medications as prescribed? For one, it ensures effective treatment. Medications are prescribed at specific doses and intervals to maintain the right concentration in your body to treat your condition effectively. Taking them correctly ensures you receive the full benefit. For example, stopping an antibiotic early allows some bacteria to survive and multiply, potentially causing the infection to return and increasing the risk of antibiotic resistance. Taking medication controls chronic illnesses. Many medications are taken to manage chronic illnesses such as hypertension and diabetes. Often these conditions have no noticeable symptoms, but the medications are working behind the scenes to prevent serious long-term complications like heart attack, stroke, kidney failure, and nerve damage. Taking medications as prescribed also avoids serious side effects. Taking medications incorrectly by missing doses, doubling up, or stopping abruptly can cause severe and sometimes life-threatening side effects. For example, suddenly stopping your antidepressant or certain types of heart medications can trigger withdrawal symptoms and land you in the hospital unnecessarily. Taking medications properly also reduces hospitalizations. Medication non-adherence is a major contributor to hospital admissions and emergency room visits. Staying consistent with your prescribed regimen helps you to avoid the costs and disruptions of intensive medical treatments. Taking medication properly also saves on healthcare costs. Failing to manage your condition can lead to more doctor visits, additional medications, and costly hospital stays. Consistent medication adherence can prevent the progression of illnesses, reducing your overall healthcare expenditures. Taking medications properly improves quality of life. By keeping a condition under control, medication helps relieve symptoms that lets you maintain a more stable, predictable state of health, improving your quality of life both physically and mentally. Taking medications properly also increases life expectancy. People born in the 1990s are expected to live 6 years longer, and medication availability plays a major role in that. Common reasons for medication non-adherence include people fail to take the medication as prescribed for a number of reasons, including misunderstanding instructions. Complex medication schedules can be confusing, especially when managing multiple prescriptions. There's also forgetfulness. Keeping track of doses and refills can be challenging for anyone, especially seniors, and especially those who take multiple medications on a daily basis. There's also the high cost of medications today. The expense of prescriptions is a major reason people skip doses and avoid filling prescriptions altogether. There may be unpleasant side effects. Some people stop taking their medication because they dislike the side effects. If you're having side effects from medications you're taking, please speak with your provider. Sometimes people feel better and they stop taking their medication. You know, I've had several patients that their blood pressure is controlled when I put them on medication and they want to stop their blood pressure medicine. And I let them know the reason why your blood pressure is controlled is because you're taking your medication as prescribed. There are patients that prescribe medications for anxiety or depression. And after a few weeks, my patients start to feel better and they wonder whether or not they should stop taking their medication. And I let them know the reason you're feeling better is because the medication is working, and it's very important you continue to take your medication. Also, there's a lot of misinformation out there. Many people consult Dr. Google or their friends and their relatives about what medication they should take and what the side effects are. I have no issue with having a conversation with those patients and coming up with a reasonable plan to manage their chronic condition. Now, how do we improve medication adherence? Communicate openly with your healthcare provider and pharmacist about any concerns you have, such as side effects, costs, or confusing instructions. Use organizational tools like pill organizers or blister packs to track your doses on a daily basis. Set up reminders on your phone or pair taking your medication with a daily routine, such as brushing your teeth or eating a meal. Another very important thing to do is to make sure all your medications are synchronized. That way, when you go to the pharmacy, you pick up all prescriptions that you're taking at the same time. Many times patients are confused because they pick up one prescription on this day of the month and then another prescription on another day. That can lead to medication adherence issues. So again, go to your pharmacy and see whether or not you're able to schedule all your medications at the same time for pickup. So what is the take-home message? Medication adherence reduces risk of sudden death from things like heart attack or stroke. It improves quality of life. It reduces the risk of hospitalizations. Medication adherence also decreases the cost associated with complications. It allows us to live a longer and more productive life. So take your medicine and like it.